Today we're going to be showing some psoas release. We got our nice coach Debbie over here and trainer Max Bernardis. What we're going to work on is getting into our psoas, which is, if you can find it, she can get her to pull her up a little bit.
Oh, no.
If you find your hip bone right about here, if your knees are bent, nice and relaxed, you're going to find the hump part right before your legs bend. You're going to dig right in deep. And if you see her face, it's nice and tight. The psoas will feel like, if anything, a tight little band. You want to take about 2 fingers in there to find it first, and then she's going to go on her other side because she doesn't need to work on her other side. You put the ball right on that spot. So again, she's going to find a nice tender area right there. Again, find the tender spot. That's the most important area, because your psoas, it doesn't just attach here at your hip. It attaches all the way up here to your underneath your ribs to your back. So if you really want to get to it, you can go in your stomach, push in there. So what we're going to do is we're going to be flossing. So flossing you're going to do is you're going to take a nice heavy weight. Right now we have a kettlebell. You can take something as simple as a hand weight, something creative. Make it at least heavy enough that you can lift it, but it still has enough force to do some damage. What you're going to do is you're going to push nice and tight at an angle. You don't want to have it straight up and down, because you're just going to hit bone more. Right, it's a nice angle. Take that, aka lacrosse ball or any other ball. You're going to push right on it. What she's going to do is she's going to make sure it's nice and angled deep in there underneath your bone, because your hip does bend in. We're going to take your leg and we're going to straighten it and bend it. If you notice, she's not breathing nice and relaxed, which is important. You take it nice and relaxed. Keep moving that leg. We're not lifting it up off the air. We're not holding it in one spot. Because it's called flossing, because just like flossing your teeth, you don't floss a little bit and then stop midway to keep it clean, do you? So we're going to keep moving back and forth about a total of probably about a minute, minute and a half. Again, what you're focusing on is, if the pain does go away, or if you're not feeling anything, you should be the pain where it should be going is about, I'll show on our other leg. You're going to feel the pain down your leg here, or a lot of times you feel it in the back, you'll feel it down your knee, you'll even feel it down your foot sometimes. You're going to keep moving back and forth. The focus is trying to get that muscle to at least release a little bit of tension, because what happens is, as you work out, lactic acid builds up. It's going to make it a little more tender. That's when you get knots, because your lactic acid is just knotting up those muscles, getting those nerves in there when everything should be flowing nice and smooth. So she's going to keep moving, nice and relaxed, breathing. And it's about a minute right there. I'm going to have her take it off to the side. And what we'll focus on is the same thing on the other side. Again, you want to make sure you're getting at least a minute and a half on both sides. Finding that hip bone nice and close to the inside. Nice. Okay. And we're going to do the same side on the other side. If you have any other questions, feel free to shoot us an email. Otherwise, have a great day.